Did you know that 264 million people around the world reportedly suffer from depression? However, there's still a large number of people who remain ignorant about the nature of depression. Common misconception is that depression looks the same for everybody and easy to identify in others. I must tell you, this isn't always true. But before I begin, I want to remind you that this video is for informative purposes only. It's not intended to diagnose or treat any condition. I am sharing this content out of personal experience. I'll strongly advise you reach out to a qualified medical practitioner or care provider or mental health professional if you're struggling. Hello, welcome back to my channel. I always ask you to stay subscribed to my channel because it's all about personal growth development on this channel. So with that said, here are 6 most often overlooked symptoms of depression that you should know about. Number 1, overeating. While most people may associate depression with weight loss and loss of appetite, the opposite can actually be true. Overeating is an uncommon but still significant symptom of depression, but if you look at it properly, it indicates a disturbance in one's normal eating habits and patterns, which is likely due to low mood, dramatic weight gain, maybe especially telling of depression as well, because most people tend to use food as a coping method when they are depressed. Number 2, oversleeping. Another less commonly known symptom of depression is oversleeping or hypersomnia. Though it is much more common for people who are depressed to suffer from insomnia, most days hypersomnia is still considered a warning sign that someone may be mentally unwell. Why? Because a sudden desire to spend most of your hours asleep indicates emotional burnout, fatigue, low energy, negative feelings, lack of motivation, and most of all, a depressed mood. Number 3, substance abuse. Though we might not immediately think that someone who uses drugs or drinks a lot of alcohol is actually crying out for help, especially if they do it frequently or at parties. See, it's very important to take a closer look at this kind of behavior just to make sure. After all, just like sleeping or overeating, a lot of people often turn to drugs or alcohol to help them cope with feelings of intense sadness. Number 4, risky behavior. Similar to substance use, you might think someone who drinks a lot, experiments with drugs, and does risky but exciting things are only having fun and looking for a good time. However, it might even indicate feelings of hopelessness, self-destructiveness, and suicidal ideation. Risky behaviors such as eating, drunk driving, getting into fights, having frequent unprotected sex, stealing, vandalizing, smoking, and so on may be deliberate attempts to put oneself in harm's way and could mean that someone is spiraling deeper into their depression. Number 5 is anger and irritability. When we think of someone who's depressed, we often picture a person who's sat down and lying in bed all day doing nothing. But frequent and sudden bouts of anger or irritability could be symptoms of depression too. This is particularly common among men. Psychologists actually believe that this is because anger is meant to either suppress their emotional torment or become a replacement for it. Many men don't feel comfortable enough to be open about their depression, or they might not even realize they have it. So they become angry and irritable. Number 6, uncontrollable emotions. I'll tell you this. Aside from anger and irritability, people may also become uncontrollably emotional. When struggling with depression, mood swings, temper, tantrums, increased sensitivity to rejection, and hysterical crying are sometimes observed in patients who are depressed. Means they are called because you were busy. They are probably going to spend hours crying and overthinking about it. Those with depression can't cope well with even the slightest of stressors and will often get overly emotional about everything. If any of these symptoms remind you of someone you know, or maybe even yourself, please remember that this content is meant to be informational and is not intended to diagnose or treat any condition, because I'm sharing this from personal experience. But if you do spot these warning signs in yourself or anyone you know, please reach out to a mental health care professional today. Found this video helpful? Please let us know in the comments below. Like and share with your family, friends, and loved ones that might find this video valuable too. And as always, thank you for watching. Remember to subscribe to my channel and hit the notification bell for more content and